you'll have. Okay. So the first task is in your section 1 of your guide. That guide is there on Moodle. It's about the current policies on health and social care in your chosen country. So you need to identify first the current government policies relating to health and social care in your chosen country. So what you're doing, you're identifying the government policies that are relating to health and social care. You're not talking about traffic, you're not talking about any other sector, you're talking about health and social care. And then the second point is to explain the impact of this policy on health and social care sector and on provision of care within your chosen country. So in the first one, you're just identifying government policies. And in the second one, you're explaining their impact on the provision of care within your chosen country. So these this extension activities tell you if you want to gain a merit, you should assess how policies meet the current needs of the population in terms of health and social care. Task 2 is your section 2 of your guide. It's about legislation and guidance that impacts on the sector. So you should outline sources and status of legislation. So first we talked about policy. Next, we are talking about regulations, legislations, and guidance. Whatever is there in your country regarding that policy that you're talking about. And then analyze the impacts of legislation and guidance on the provision of health and social care provision and on health and social care workers. So you need to, if you want a merit, you would analyze the aims and the purpose of legislation and guidance. In order to gain a distinction, you would want to assess the implications of a failure. If there's a failure to comply with legislation or guidance, what would be the implications? So task 3 says that in the final section of your guide, you have that guide again on Moodle. It looks at principles and values that underpin the provision of care within your chosen country. So you should be able to describe the underpinning principles of health and social care and outline how these principles impact on the provision of care. And in the explanation part, you will explain initiatives to promote the fundamental principle amongst those working in health and social care. Again, to gain a merit, you would assess how the underlying principles support basic human rights. And in order to gain a distinction grade, you would assess the implications of failing to adhere to fundamental principles of care. So that's about it. Please, this is just something that I've given you in a nutshell. And I would be going in detail about how you would have to submit your assignment, what are the fonts that you'll have to use. I'll go in thorough detail on the 28th of April when we meet again. Is that okay? This is just a nutshell in order for you to focus on what is expected from you within this unit. Is that okay? I think that's
yes, it is, I think.
Yeah, that's fine. Thank you. So now if we go to our main session, start sharing my screen with you. If you have any questions in between, please let me know. You can always type them in. So the first unit that we are going to cover, it's going to be an interactive session. So I'll expect every one of you to interact with me as much as you can. I hope this PowerPoint is, you can see this PowerPoint actually. Can everyone see my screen? Yeah, that's fine.
Yes, we can.
So basically, we are going to focus on the current policy on health and social care. Now keep focusing on your assignment. So we're talking about policy. So you're going to work on policy within your chosen country, and it has to be health and social care related. So now what the learning objectives cover is to understand the current policy on health and social care. So the learner here should be able to identify current government policies relating to health and social care in your chosen country. Explain the impact of policy on health and social care sector on the provision of care within your chosen country, and to assess how policy meets the current needs of the population in terms of health and social care. We've talked about this earlier for your assignment. So what are policies and procedures? Just a bit of definitions and what they mean. So the policies in health and social care sector, they can be split between four main groups. This is the policies that we're talking about. So in policies, we have administration. So policies including matters like data protection and information security, they'll have an administration or someone within the administration who will be overseeing these concerns. So whenever you're talking about policy, you should be mentioning data protection and information security. Why is that so? If I ask you, why is it so important in data protection and security? Let's start with the first one, data protection. What do I mean by that?
These are confidential information of patients and people we come in contact in health and social care, I think.
Okay, thank you. Anything else? Anyone else?
Just about, as we said, just about information, protecting information.
Yeah.
For every individual.
Brilliant. Anyone else? Okay, that's fine. So data protection is very important. Confidentiality, maintaining confidentiality of your patients is very important, or anyone you're dealing with. Their data protection and information needs to be protected. So that is why data protection is so important. Health and safety. So policies including matters like you have fire safety, you have lone working policies. So that has to be there. So you should, wherever you're working, there should be an administration to look over data protection, information security, and should be and this health and safety is not just for the service users, it's for the people who are working there as well. Human resources. So within the policy, you will have human resources also. So policies including matters like confidentiality, equal opportunities, disciplinary, and grievances. So your human resources will be the overarching thing that will be looking at all of these components. And then the fourth is service delivery. So policies including adult protection and complaints, suggestions and compliments, and service user development and involvement. So these administration, health and safety, human resource, service delivery, these are part of the policies in health and social care sector. So when you're talking about policies, always focus on these four. Policies and procedures. So there's a policy framework that sets out principles of good practice in the management and conduct of health and social care within the UK. So every organization should have a framework. In those frameworks, you have the principles that we have to follow. This is for every organization. So in the policies and procedures, you'll have guidelines, you'll have laws, you'll have how to conduct these, you'll have constraints, you'll have different plans, you'll have different solutions, you'll have regulations, you'll have standards. All of these come within policies and procedures. So these principles, they will protect and promote the interests of the patients, the service users, and the public in health and social care. And this is by describing ethical conduct and proportionate assurance-based management of health and social care. So whatever you do, ethical conduct should be there within your practice. This is just to assure that whatever practices are there in place, they're ethically designed. So here you're identifying the current government policies relating to health and social care within your chosen country. Just keep thinking about your chosen country that you'll be focusing on. So the Department of Health and Social Care, DiHSC in the UK, it's the UK government department that is responsible for government policies on health and adult social care matters within England. So this is what you have, the DiHSC, that deals with health and adult social care matters. So it oversees the English National Health Service, or the NHS. So this is the department which is led by the Secretary of State for Health. So the NHS is led by the Secretary of State for Health and Social Care, with 3 ministers of state and 3 parliamentary under Secretary of State. So you have the Secretary of State for Health and Social Care. You have 3 ministers of state, and you have 3 parliamentary under secretaries of state. Okay, so there are total 6 people working under the Secretary of State. This is the way the government, the NHS is set up, the main NHS. So you're identifying current government policies relating to health and social care in your chosen country again. So the department develops policies. So what is the NHS doing? It's developing policies and guidelines in order to improve the quality. So whatever you're doing, the ultimate goal should be to improve the quality of care and to meet patient expectations. So different patients have different expectations. You cannot always meet them. Sometimes you meet them, sometimes you don't, but your ultimate goal is to meet them actually. It carries out some of its work through different features like arm's length bodies, including executive non-departmental public bodies such as the NHS England and the NHS Digital. So if you're working on policies and guidelines, so it's not just the NHS that's working, it has different organizations that are working together within the NHS. And then you have executive agencies like Public Health England, the UK Health Security Agency, Medicines and Healthcare Products Regulatory Agencies. These are all agencies that are working within the NHS. Different agencies have different functions, obviously. Again, with the same LO, what are legislations? What are the legislations we're talking about? So the Health and Social Care Act 2012 or 2012, it was introduced, and it introduced the first legal duties about health inequalities. So it included specific duties for health bodies, including the Department of Health, Public Health England, clinical commissioning groups, the NHS England, which require the bodies to have due regard to reducing any health inequalities that persist there between the people of England. The Act also brought in changes for local authorities on public health functions. So health inequalities, they're faced everywhere within the globe, but they're more likely to happen when you have ethnic minority groups. So we don't call them BAME communities, we call them now people from ethnic minority backgrounds. So they're more likely to face health inequalities, which research has shown. So what is the function of these legislation? This legislation, Health and Social Care Act 2012, actually works on reducing these inequalities. So the Equality Act, again, as the name suggests, 2010 established equality duties for all public sector bodies, which aims to integrate consideration of the advancement of equality into day-to-day business of all bodies subject to the duty. So we are again talking about involvement and advancement of equality. Again, talking about the government policies. So you have some main legislations that we've talked about, 2 main legislations. We have some supporting legislations also, such as the supporting the Social Value Act 2012, which requires the public sector commissioners, which includes the local authorities and the health sector bodies, to consider economic, social, and environmental well-being in the procurement or achievement of services or contracts. So you have the Social Value Act. Now, the Social Value Act will obviously talk about social contexts. You will have the economy there, and you'll have the environmental well-being. Again, you're talking about every service or contract that is there should endeavor to consider these three social values being in their well-being. So creating social values, this has clear connections with efforts to reduce health inequalities through actions on social determinants of health. Okay, so you have employment and housing as your social determinant of health. What is actually a social determinant of health? What do I mean by a social determinant of health? Anyone?
Sometimes I think it's about like the community where you live and how much health is accessible to that community, I think.
Okay, thank you. Anyone? Anyone else? What do we mean by social determinants of health? You can mention anything. You don't need to be very specific.
Could they be financial as well?
Yes, it could be.
Yeah, okay.
So your economy is a social determinant of health. So what do I mean by determinant? Determinant means something that determines something. So your health is determined by some aspects such as your gender. So we know that a female can have her ovaries could have cancer. God forbid, she could have breast cancer. That is not related to males, obviously, but a male could be having a prostate cancer, which is not likely to happen in females. Likewise, you have certain factors that increase your risk to develop a disease, like uh, your hereditary factors. So if your parents or your grandparents had a disease, most likely you would be having the disease. You're lucky if you don't have it, but your offsprings might. You have to protect them against those diseases if you already know that your ancestors have them, or if you've had that disease. Like hypertension, like diabetes, this can run in the family. These are also determinants of health and disease. So you have determinants of health and you have determinants of disease. So age, your gender, as you age, you have you have chances of developing more diseases. Younger ages have different diseases, older ages have different diseases. Your gender determines your disease. So these are determinants of disease. Now you have determinants of health or disease, which are social determinants. So in the social context, you have different factors. So you have your employment, you have your housing, you have so with employment, you have your finances, your economic condition, you have education. Okay, so you have and you could have apart from this, you could have sanitation, for instance. You could have your employment, within employment. So let's talk about inequalities within employment, let's say, or within housing. So if you have not very healthy housing conditions, or your environment where you're living is not healthy, you are not going to be healthy. So it's determining your health, or it's determining your chances of having a disease. That's called a social determinant of health or a social determinant of disease. So if you're from a particular Black community, or you're from an Asian background, you're more likely to suffer from these health conditions because you do not have the perfect living environment. Why is that so? Because you don't have proper employment opportunities. That is again a social determinant. So these social determinants have been focused on for years and years, and then they came up with this Social Value Act. And now they want equality within your employment, your housing conditions. Doesn't matter what gender you belong to, a male or a female doesn't have any superiority over anyone based on their gender. or based on their gender roles. So you can't say that he's a male or he's a female, and then he will have the opportunity or she will have the opportunity of climbing that ladder faster compared to the other gender. No, those inequalities were there for a very long time. They still are there. They're social determinants of health and disease. But these determinants are now being studied so extensively just so that there is equality within them also. So defining social value with reference to the social determinants of health, they can help to reduce local inequalities, improve health and well-being of local people, and in the longer term, reduce the demand on health services and other services. So you won't have many sick people then. You won't have many people coming for their treatments because you'll have healthier environments, you'll have more economic involvement of every sector or every background. whether they're in the minority group or not. So then there are policies in healthcare that are vitally important as they set a general plan of action. So you have a plan of action from every policy, which then is used to guide desired outcomes and are a fundamental guideline to help make decisions. The purpose of healthcare policies and procedures, they're there to communicate to employees the desired outcome of the organization. So there is an organization that has an ultimate outcome or a desired goal that has to be achieved in whatever number of years. So these policies and procedures actually support you in achieving those goals. So other government policies can also affect provision, like you have the economic policy of the government that covers the systems for setting levels like taxation, government budgets, money supply. You have interest rates as well as the labor market, national ownership, and many other areas of government interventions into the economy. So you have an economic policy also. Then you have the immigration policy. So these policies, you this lecture makes you aware of what policies can you talk about or what can you write about in your assignment. Then you have an immigration policy. So it's a policy of a state that deals with the transit of people. Every country will have an immigration policy. So because this is related to social care. So it's the transit of people across its borders into the country, but especially those that intend to work and stay in the country. So visiting is a different policy, but immigration is a different policy. So immigration policies can range from allowing no migration at all. There are countries that have zero migration, emigration. So the zero number of people are coming within the country, to allowing most types of migration, such as free immigration. Immigration. So sometimes, you have to actually pay for migrating somewhere. So some people at the UK, you have to pay. Certain communities have to pay. Certain countries have to pay. If you're living in a certain country, your passport status, your legal status has different rules and regulations. So there's a clear immigration policy within gov.uk. So anything that you want to access within the UK, anything at all, it's freely available on gov.uk. So it comes to everything, actually, everything. You'll be surprised that there's one whole umbrella where you can go for anything at all, free of cost. So almost any citizen or resident of any country of the signatory nations may move and see work anywhere within the European Union, and there is little that member states can do to stop it without leaving the European Union or negotiating the treaty. So these are all the rules. There may be many impacts. Now we're coming toward the second part of this LO. So you're explaining the impact of policy on health and social care sector and on the provision of care within your chosen country. So there can be many impacts. I'll talk about these three. We've talked about policies. So there could be provision of facilities, there could be employment of staff, there could be commissioning of services, any other impact that you can think of. Anyone? impact of these all policies that we've just talked about. Anyone? No? So let's say you have a policy on equality. No, you have the policy on, what policies did we talk about? The economic policy. So the economic policy can have levels of taxation. So what if the taxation increases? What will happen? You would be impacted, isn't it? You're not getting much out of your wages, and most of it is being deducted in the taxation. What would you have? You would have lesser opportunities of having a good life. So again, let's talk about the immigration policy. So if there's a different change in the immigration policy, what would happen? There'll be less immigrants coming in the country. Or if there's an increase in the number of immigrants that that the policy says it can allow anyone, what will happen? There will be an influx. And then ultimately there'll be one time when the government, any government, you can talk about your country's government, they won't be able to provide for the facilities. So it's only an extent to which they can have people. This is just for the immigration policy that I'm talking about. So it has several impacts on provision. So let's say your employment of staff, if it's increased within the NHS, what would you do for their wages? You have a plan for their wages and for everything that they require there. Do you have a plan for their training? That also has to have be in that policy, because obviously you can't just employ and leave them on their own. They have to have constant training to progress, obviously, and for the system to progress. So if there's a large employment of staff within the NHS, the patients will be happier. But if they're not trained properly, let's say, if they don't have proper training and you're just employing staff just for the sake of filling places, you're just wasting resources, wasting time, wasting money, wasting energy. So that should be kept in mind. So there are different factors that impact, different ways that the policy impacts on provisions. So we're talking about provisions, provision of health, employment of staff. So if I'm talking about staff within the education sector, there will be provision of education or training of students. So if you're employing staff, you need to be sure that they're fully trained and their constant, continuous training is there in place. So this is just one example of employment of staff. You can have other examples also. Explain the impact again on policy on health and social care sector. On the provision, again, we are talking about provision. So what are the provision of facilities? Workers must have access to. If you increasing, sorry, you're increasing workers. So there should be welfare facilities where the workers must have access to toilets, hand basins, soaps, towels, or a hand dryer. Then they should have a place to store clothing and somewhere to change if special clothing is worn for work. There should be drinking water facility. There should be somewhere to rest and eat meals. There should be health and safety work, etc. So these policies should be there. So if you're increasing the number of employees, you should have these provisions of facilities. So these facilities are not only for those people who are using the services of these workers. They should be there for the workers as well. As I said, their training should also be there. There should be a part on the training also. Anyways, so explain the impact again of policy on health and social care sector. So whenever we say explain, you have to give more in-depth information on it. So if it's just describing, you have to describe something. It's not the same as explaining. Description will be limited. Explaining will be more analysis, more talking about it or writing about it. So a healthy working environment, what does a healthy working environment have? So there should be good ventilation, supply of fresh, clean air drawn from outside or a ventilation system, reasonable temperature, so it's comfortable to work. Then you have different kinds of work. So if there's a labor, their temperature should be different compared to a worker who's working within the office. So if it's very hot for the labor, it's not a healthy working environment. Although the worker is still expected to work within that environment, it's not something that the worker will actually, obviously the worker has every worker has their own rights. So that is why we have a baseline assessment. Every good organization has a baseline assessment of the health condition of that worker. So if the health condition is perfect, and if it deteriorated with time, let's say someone who's working in a coal mine or someone who's working in a factory that has a lot of fumes, if they were healthy earlier and now they're not healthy, after 2 years they developed cancer, let's say, of the lungs because of the fumes that were there. It's not a healthy environment, so it shows you the link that this person was perfectly okay 2 years back when you hired them. And if their family history is negative, if they don't have a family history of lung cancer, if they're not a smoker, for instance, it should be the work that has led to this. And according to legislation, that person can sue that organization. So it's very important. Lighting should be suitable for the work being carried out. There should be enough room space and suitable workstations and seatings, depending upon whatever work it is. A clean workplace with appropriate waste containers, if it's a hospital setup particularly. What's a safe? So we talked about an environment that is a healthy working environment. We're talking about a safe workplace. Again, we're talking about the impact of policy on health and social care sector, on the provision of care within your chosen country. So a safe workplace should have these things in place. So you maintain your premises and work environment, keep floors and traffic routes safe of obstructions, have windows that can be opened and cleaned safely, and make sure any transparent or glass, such as glass doors or walls, are protected or made of safety material. So you might not see very much of these in offices. We're coming towards the last bits of our slides. So again, you have the several legislations that may be adhered to when you're talking about employing staff. So you have the Employment Rights Act 1996 that covers the rights of employees in situations like dismissal, unfair dismissal, paternity leave, maternity, and redundancy. You have sick leaves also here. So then you have National Minimum Wage Act. This act sets out national minimum wage for employees and employers across the UK. So you should know about this. Employment Relations Act 1999, which establishes a number of rights at work for trade union recognition, derecognition, and industrial actions. You have part-time workers, Regulations 2000, a UK labor law measures that requires that the employers give people on part-time contracts comparable treatment to people on full-time contracts who do the same job. So you're not going to give access job to a part-timer if they're working within your organization. You're going to give them according to their contracts. So a full-timer will have more work to do, obviously. The Equality Act, an act that prevents discrimination in workplace and the recruitment processes. So now we are explaining again the impact of policy. So commissioning of services should be according to the Health and Social Care Act 2012. So it is, what is commissioning? It is the process by which health and social care services are planned, purchased, and monitored. So we have a look at commissioning processes in more detail. organizations involved and how it is changing. So what is commissioning? It comprises a range of activities. So it includes what the needs are. So you're assessing the needs of the people. It also focuses on planning services, procuring services, and monitoring quality. So here you have a cycle where you have patient or public involvement. So there are different types of planning. There's strategic planning. You're procuring services. How much do you want to procure? What do you want? You want face masks, you want equipment. And then there's monitoring and evaluation that has to be there in every organization. So within these, so if we talk about procuring services, what comes into it? You're designing services, you're shaping structure of supply, and you're planning capacity and managing demand. So how many do you want? How much are you procuring? This is according to demand. Then you're monitoring and evaluating. So this is supporting patient choice. You're managing performance, and you're seeking public and patient views. So this is how do you monitor and evaluate that the system is working properly. So these are the measures where you manage performance, you're looking at what performance is happening, you're supporting patient choice through it. And then the last in the circle is strategic planning. So you're assessing needs. So this is obviously collected through data. What are the needs, basic needs, reviewing service provisions and deciding what priorities are needed. So you don't have to prioritize everything. Obviously, the priorities are set and the most important are dealt with first. So the concept of commissioning was introduced into the NHS in the early 1990s when there were reforms that separated the purchasing of services from their delivery, creating an internal market. So there was an argument that was made from the providers competing for resources that would encourage greater efficiency, responsiveness, and innovation. These arrangements have evolved since their introduction, and this includes numerous changes to the structure and remit of the organization that commission care. The current arrangements were introduced by the Health and Social Care Act 2012. The last one, what we're talking about is assessing how policy meets the current needs of the population in terms of health and social care. So you carry out an assessment and comment on how well the existing policy meets the needs of the population. So for instance, is it the infrastructure? Is it sufficient? Is more funding required? So you're assessing if these are required or not. So you're assessing here and commenting also how well the policy that you're talking about meets the needs of the population, and are inequalities being addressed and overcome. There could be many other examples also. So infrastructure in healthcare, what does it deal with? It's a key pillar supporting the fundamental aim of promoting improved standards of care and well-being for all patients, together with a good experience of the healthcare system. In parallel, the healthcare system and staff have to support effective health promotion, prevention, and self-care of the whole population. So the basic physical and organizational structures and facilities are included in it. They're needed for operation of a society or enterprise. This is the infrastructure in the healthcare system. Then assess how policies meet the current needs again. So infrastructure must integrate the hospital as the center. And this is for the Center for Acute and Inpatient Care, and should facilitate the 7 domains of quality. What 7 domains of quality do we have? We have patient experience, we have effectiveness, efficiency, timeliness, safety, equity, sustainability. So all of these must be a part of the infrastructure within a hospital in order for a hospital to have to be working effectively. So your patient experience should be there, your effectiveness should be there, you should be efficient with whatever resources you have. Timeliness is very important. There should be safety, equity, and sustainability. So infrastructure would also include the built environment. How are the streets built? How is the building built? Is it enough lighted? Does it have enough enough space there for people who are working more there? Does it have IT services? Are the systems and processes working there safely? So you have a whole sector on how to build a hospital. This is all the construction side. So if a hospital is built and it doesn't have the anti-slip measures there, you're going to have more accidents there, isn't it? Then coming towards so the UK currently spends about 140 billion a year on public provision of health and over 20 billion on social care. That's a good amount. So funding is mostly from income tax, the payee income tax, the national insurance, and through charities. There are other factors also, but predominantly it's from this. And then coming towards health inequalities, one of the last parts that we are dealing with. So they're being addressed in several ways. So health inequalities, they can be addressed through training of staff that should be equal for all the staff, accessible appointments, mobile clinics for remote areas. Remote people cannot access medication or cannot access health. There should be excellent mobile clinics for them, not compromising with quality at all. Health campaigns can be there so that everyone can access them. And then care navigators to inform, advise, and direct on the rights of a service user. So that's about it. We've looked at current government policies relating to health and social care in your chosen country. That's the UK that we're talking about. The impact of policy on health and social care sector and on the provision of care within your chosen country, and how policy meets the current needs of the population in terms of health and social care. So you have these references. You can go through these references and have a better understanding of whatever we've talked about so far. You can have more in-depth understanding. The references here also. So that's about it from my side. Any questions? Anyone have any before we leave? Please let me know.
No questions for me.
So this, this PowerPoint presentation, the video will be on your Moodle page by Monday.
All right, that's fine. Thank you.
No problem. Thank you.
Okay, that's okay. Okay, so off you go and have a nice day. And I'll meet you tomorrow, same time.
Okay.
Thank you. Thank you. Take care.
Thank you so
All
much.
right, bye.
Thank you. Bye. Bye.